Coming up,
Hypertension. Are you okay, Mr. Simmons?
this university offers a unique nursing school experience with full real-world simulations. The state-of-the-art program prepares students for the basics, emergencies, and more. Plus, our friends at Publix have some new items to look out for in the produce section, and we'll share how mosquitoes can be more than just a nuisance to your skin. All that and more is today on SoFlo Health. Hello and welcome to SoFlo Health. I'm Hunter Franke. Behind me is the Florida Atlantic University Davie campus, and you're in for a treat because we were invited to the Christine E. Lynn College of Nursing to check out their sim lab. They have an entire wing that is just dedicated to simulating what it's like to be in a hospital environment to prepare nurses for anything. I'm really excited to check it out and to speak with some of the faculty and students, so let's head inside and learn more. As promised, we're now at the Christine E. Lynn College of Nursing Davie campus. This is their simulation lab, and I'm joined by Dr. Archer, who asked me to call her Andrea. So, Andrea, thank you for having us in your space.
Thank you for coming. Welcome to the Christine E. Lynn College of Nursing on the Davie campus. So it's two components. We have the simulation lab on the other side. On this side is basically our skills lab, where students are afforded the opportunity to practice in a safe environment, allow repetitive practice to sharpen their skills. It bridges the theory to clinical practice. So what they learn in theory and practice here prior to in a safe environment without harm to patients, so they're able to, before they hit the hospital environment, they've already familiarized themselves with the skills.
Wonderful. So, and what sort of skills are they able to garner
so
here?
The skills we have here, it could be a basic starting with bed baths, but then we move into IV starts. Right? So blood draws, inserting peripheral IVs. We have our cart here that basically has all the supplies that we may need in order to start an IV. And then we have our arms here with our simulated blood. Other things they could do, suctioning. So you see our suction set up here. If we need to suction our patients. We have what we call our Dynamap. And the Dynamap basically is the machine that we use to do vital signs. This area we have our supplies. This is our medication cart. This see listed with all the meds.
That's a lot of meds.
Right, that are, and it would be very depending on what the patient's diagnosis is and what treatment we're going to be doing, and we're able to practice our injections.
Yeah, those effectively cubes of flesh.
Yes, those simulated.
Let's take a look at that real quick.
So we can do whether it's our ID, intradermal or subcutaneous, or intramuscular. So that affords us the opportunity to practice what angle.
So you have different ones for different purposes.
And different needles.
Wow.
Correct.
Well, what I'm very impressed by is that, as you can see here, there's plenty of labeling. Everything is organized. It looks like a hospital environment, and I think that's the goal.
And that's basically the objective here, to make sure that we get engaged learning where we have, before they get into the hospital environment, they're exposed to basically exactly what it will look like and feel like and what they're able to do.
Wonderful. Well, there's more over here, so let's go take a look.
The College of Nursing is really helping us serve our community. One thing that's really important to FAU and to us in the college is that we are meeting the needs of our community and surrounding areas. Our nursing students are prepared when they leave our program to work in anywhere that a nurse can be, whether that's a hospital or a home health care setting.
It's not an easy program. It's definitely a lot of hard work, a lot of dedication, a lot of study. And you just have to be confident that this program is designed to make you the best nurse you can be.
So Andrea, what do we have over here?
So what we have here is, as we try to create an environment that the students are able to practice what they're going to see in the hospital environments. We have our linen cart. All the supplies that are required in terms of your gowns all the way down to your sheets, in terms of your AM care for the patient.
And what's happening over here?
And then what's happening over here, we have one of our senior students, and another skill that we do is in terms of our dressings, right? So wound care. Other skills that you may see is Foley insertion or Foley catheter insertion if somebody is not in terms of urine output. We also can put NG tubes in, and that is either used to decompress the stomach or to provide feeds if the patient is not able to swallow effectively.
And we heard from the dean that you start as early as a freshman, whereas many other programs don't start until junior year. And I think that anybody that has a nurse working with them would feel better that they had an extra couple of years with this sort of hands-on skill available to them when you're the patient.
And absolutely. And on the Davie campus, we have the accelerated Bachelor's in Nursing program. It is a 4-semester program. See, they come in with all their prerequisites, and then we have 4 semesters.
Very exciting.
So here they're able to get all the skills, all the practice they need to sharpen the skills prior to going into the hospital environment.
There's so much we could get into in just this room, but this isn't just it, correct?
Absolutely. We are going over to the simulation lab where we'll see our high-fidelity mannequins.
Excellent. We'll head over to the sim lab. You keep watching SoFlo Health. Let's go. More from FAU and a visit to our friends at Publix are after the break on SoFlo Health.
Focusing on you. Innovations in modern medicine. From your team of experts at Desai Seti Urology Institute, part of the University of Miami Health System.
When Will Naris was diagnosed with prostate cancer in his 30s, he thought life as he knew it was over.
Is this it? Like, how big is it? How small is it? Like, do we need to act now? Do we need to, take it apart?
He went to see Dr. Bruno Nahar, a urologic oncologist at Desai Seti Urology Institute, part of the University of Miami Health System.
1 in every 8 men will have prostate cancer during their lifetime. It's more common in older men, but younger patients might also be at risk. Traditionally, we would offer surgery or radiation therapy, but they do come with side effects, particularly erectile dysfunction, urinary incontinence.
Because of his age and the size of the tumor, Dr. Nahar said Will was the perfect candidate for the HIFU procedure. This allowed him to have fewer side effects and maintain normal function.
HIFU stands for high intensity focused ultrasound. It's essentially very precise and targeted ultrasound waves that we deliver to the prostate to treat only the area where the cancer is, and we save the rest of the prostate.
Desai Seti Urology Institute and Sylvester Comprehensive Cancer Center work together to offer precision medicine, helping patients like Will get targeted care and renewed hope.
Thank you for giving me hope and extending my life.
Welcome back to SoFlo Health. I'm Hunter Frankie. This is Andrea. We are still at the Christine E. Lynn College of Nursing Davie campus for Florida Atlantic University, and this is the Sim Lab. Earlier we saw the Skills Lab. What are we seeing here?
So what we're seeing on this side is the opportunity for our simulation in terms of what we call our high fidelity mannequins. And what our high fidelity mannequins can do is basically replicate what we're going to see in terms of patient interaction, communicating with patients. We have our OB mom, we have our pediatric patient, we have our what we call our sim man. This is a high fidelity mannequin, as with the others that we can simulate. We can respond, they can do their assessment, and we can have the interaction that you would have in the clinical environment.
Yeah.
Are you okay?
And it reacts too, like a person.
Oh yeah, you can hear a respond, we can have the communication. This is our control center, and in the control center, the communication with the patient in terms of answering questions, coughing, the ability to assess lung sounds, bowel sounds, and we can change the presentation of the patient, just like would occur in the hospital environment. So then the students are able to practice in a safe environment what you would do if this situation were to occur.
They're really experiencing and knowing what's happening step by step. So it makes sense adding it to what they learn in class to them. So by the time they go to hospital, it makes sense to them.
As you can see behind us, the doctor gets a call, heads into the room to do their aspect of the care, and we've got our other camera operator, Juan, in there showing you up close and personal look of what it looks and sounds like in there. I reacted earlier because I'm standing here and I heard and I was like, whoa, is that just everybody having fun making sound effects, or is that actually what's
No,
presenting?
it was actually the patient
That's
probably
pretty
having
cool.
some discomfort, some pain, the patient's ability to cough and communicate and answer the questions. I'm dizzy, or I don't feel well.
Wow.
We can simulate all of those experiences so the student is prepared once they get into the clinical environment based on the protocols. What is it that we do? This is why this is called the simulation center, right? We can simulate all of those situations.
I'm in one of my favorite sections with one of my favorite people, and that's Lindsay Willis of Publix. Lindsay, thanks for having us in.
Thank you. Thank you for being here.
Of course. It's good to see you again.
Good to see you.
I'm excited because we're next to berries, and they're one of my favorite things.
We are in the produce section, and we have a lot of berries to show you.
Certainly. What's going on?
So we have a ton of different options here, from raspberries, blackberries, strawberries.
Yes, and this is one of the things I think is a staple, which is why it's such a big section.
Exactly.
That everybody loves to come and visit.
Yes.
And you also have some other ways that you help people save time with the produce. So let's go check that out.
Let's
next.
go.
Let's go. Still in the produce section, but Lindsay, what do we have here?
We have a number of different options for you here as you start to think about meal prepping and what you're going to cook tonight. We have so many ideas that are already pre-cut.
I'm actually a big fan of these green beans and these broccoli florets. I'll just throw them in an air fryer, like you say, real quick. Don't have to think about it too much. Drizzle a little olive oil on it.
Oh, nice.
And just easier than buying the whole thing, chopping it up. You can do that, and that's fine. It's a good skill to have, but I don't want it. It's simple as that.
That's awesome.
However, I do like to eat local and eat fresh, and you make that easy, correct?
We do. Let's go show you some.
Let's do it. Again, very excited because this is one of my favorite parts of Publix. You make it so easy to know what's fresh and local.
We do. We always have it marked for you, so always keep an eye out for that. That way you can see the new options that we have out there, and you can also check for sales.
And then, of course, the other section of, I guess, what you would call like even fresher produce?
Yeah.
I don't know. That's
Very
what I think
fresh,
of.
and you can pick out your pepper, you can pick out your cucumber right here and go ahead and put it in your recipe.
If people want to find out more about what you have here at Publix or their local Publix, how can they?
They can go on Publix.com on our website, check that out. You can also check out your local Publix and see what we have.
Definitely, and always keep an eye out for those BOGOs.
Yes, always, and they change each week. So we have on average 80 different BOGOs a week in our weekly ad. You can check them out online, you can check them out in the store as soon as you walk into our information center. Pick one up.
Great. Well, Lindsay, thank you so much for your time.
Thank you.
Of course. An important message about heart health and why you should take extra care around standing bodies of water when SoFlo Health returns. Welcome back to SoFlo Health. I'm Hunter Frankie. I'm in the Christine E. Lynn College of Nursing Davie campus. This is their skills lab where we were earlier with Andrea. She was showing us around the room, and while we were exploring in between commercial breaks, I happened to see that you can actually feel the veins on these arms. And she confirmed that's exactly what they have students do, is feel for veins. And then it's a little obvious here where the veins are because of all the tracks from students using it, but there's some others up here. And you can actually draw blood from these. So this isn't just a simulation in the sense of, oh, you get the picture. You're pretty much all the way there without affecting a human being while you practice, which is pretty cool. And there's still more to see here at FAU, but you need to keep watching SoFlo Health. What's South Florida's unofficial state bird? Is it the parrot? Is it the flamingo? You would think it would be the flamingo. The official state bird is actually the mockingbird. But I'm talking about the unofficial state bird, the mosquito. And these pests don't just ruin your barbecue, they could be stressing out your immune system as well. When a mosquito bites, it injects saliva proteins, which your body sees as a threat and sends out histamines to fight those invaders. Those histamines then cause itchiness, redness, and swelling. So translation, you're not just itchy, your body's waging a microscopic turf war. Most mosquito bites are harmless. However, they are a virus vector for many viruses, including some like West Nile, dengue, or Zika. Yes, they're rare, but it's a good enough reason to avoid mosquito bites if you can. In order to protect yourself, repellent, long sleeves, and making sure you don't have any standing water in your yard is a great start. However, there are also some foods that you can enjoy that will help you repel mosquitoes, and those include garlic and onions. The only problem is that they might help you repel humans as well. South Florida's subtropical climate, frequent flooding, and urban areas prone to standing water make it a breeding ground for mosquitoes, quite literally. It's not all bad. Mosquitoes serve as a food source for various creatures, including birds, bats, dragonflies, spiders. And in the Everglades, mosquitoes' larvae are consumed by fish and amphibians, supporting biodiversity and a healthy ecosystem we all can enjoy. In South Florida, air conditioning isn't just comfort, it's survival. But living like you're in an indoor igloo has its downsides. Air conditioning dries out the air, which can dry out your eyes, your skin, and your sinuses, and that dryness can allow germs to slip in and create more sniffles or sinus infections. Drinking plenty of water and actually going outside into the heat and humidity for a while, a few times a day, can help avoid this. Spending too much time in chilly, low-light rooms can mess with your circadian rhythm, which is your body's internal clock that allows you to sleep and wake at certain times of the day. And messing with that can really mess with your mood, your energy, and your sleep. So to recap, in order to avoid the pitfalls of too much air conditioning, make sure you keep your rooms at a reasonable temperature. 76 degrees is cool enough. Go outside for some fresh air or open a window every once in a while, get some sunlight, stay hydrated, change your air filters, and maybe even get an air purifier if you're thinking about it. On second thought, it is a little hot. Can we get a fan on in here or something? That's better. Yeah. Behind me is Jackson Memorial Hospital. We're about to head upstairs to the Jackson Heart Institute to talk to Dr. Malidi and find out what they're doing here to keep you heart healthy. As promised, I'm now joined by Dr. Malidi of Jackson Heart Institute. Doctor, thanks for sitting with us today.
My pleasure.
So tell me, what is Jackson Heart Institute?
The Jackson Heart Institute is the cardiovascular service line for the Jackson Health System.
And who is this for? Who are you seeing the most?
Over the past year, we've seen plenty of patients who were told that, well, we can't, really, there's nothing we can offer. And often it's the doctors themselves that call us and say, well, we can't really take care of this patient here. They're too sick, they're too complicated. Our hospital isn't, geared for this kind of stuff.
Yeah.
And we accept the patient and do the best that we can, knowing that, what we have to offer is not sort of possible at a lot of other places.
What are some of the innovations that you see here, or what's on the cutting edge of what's happening here on a regular basis?
So in terms of the Heart Institute activities, the areas of focus that we're trying to develop are really in three different broad areas. One is in the heart failure transplant VAD space. And another is in sort of developing a complex or aortic surgery center of excellence within the Heart Institute. So these are patients that have a problem with their aorta, which is a big blood vessel that comes out of the heart. And often you'll hear about people with aortic aneurysms or aortic dissection. And the Heart Institute or Jackson Memorial has always cared for these patients. It's nothing new. What's different is really sort of going beyond and becoming more focused on offering sort of the latest therapies, the latest techniques, and taking care of sicker patients.
I've heard about a new term to me today, which is redo surgery. What is that, and how does that play a role here in what you're doing at the Heart Institute?
Because the results of surgery are getting better and people are living longer, so patients who've had surgery 10, 15, 20 years ago, they, if they had a valve replacement 20 years ago, the valve is wearing out and they need something else done now.
Who's a good candidate, and who watching right now would you encourage to come here and find out more about either themselves or get checked out?
I think anybody that is worried about, decreasing exercise capacity, anybody who's worried about shortness of breath or chest pain, who's dizzy. But it's important that people understand that we take care of all patients, whether it's just basic diagnostics or whether it's somebody that needs the most complicated redo heart transplant. We will take care of you.
Doctor, if people would like to find out more about what you're doing here, how can they do that?
I think the easiest way for people to get more information is just to go online and visit our website. They can get the information that they're interested in and learn more about their heart disease as well as the Heart Institute.
Great. Thank you so much for your time. Welcome back to SoFlo Health. I'm Hunter Franke, and class is no longer in session here at Florida Atlantic University's Christine E. Lynn College of Nursing, Davie campus. We spent the day here in the skills lab and in the sim lab earlier. We spoke with the students and the faculty, and what I took away from it is that they're prepared to do anything in any field of nursing after going through the program here because of all that is available to them. And the best part is they feel so confident. Part of that is due to where I'm sitting right now, which is an area where they debrief. They have cameras in the sim room so they can watch other students in action or themselves, and they can even break down after the fact and say, okay, here's where I went wrong, or here's where I can improve for the future. And that should make us feel great because we are prospective future patients and probable future patients at that. So I feel pretty good after meeting some of the students here, and you should too. That's all for this week's episode of SoFlo Health. Thank you so much for watching. As always, you can watch previous episodes of SoFlo Health on SoFloShows.com or on YouTube. You can also follow us using @SoFlo Health to share with us what you're doing to stay healthy. Until next week, it's goodbye and good health.